Let's now talk about arthritis and joint pain. There's a whole bunch of problems that happen in the joint. Let's talk about arthritis, fire of the joints. Now, there are dozens of forms of arthritis, but the major ones are osteoarthritis, which is the ending arthritis of virtually all of them. Rheumatoid arthritis, very common. Scleroderma, similar to rheumatoid arthritis, as is systemic lupus. They're similar to rheumatoid arthritis. But all of them will come in as osteoarthritis. Now, osteoarthritis is this end stage where people are damaged in the latter years of their life. They could have had an injury to the joint. They can have chronic overuse of the joint. Basketball players have arthritis in their knees all the time. They could have an anatomical misalignment of the joint. Sometimes this follows a fracture with malhealing or misalignment. Then they could have the overuse of anti-inflammatory drugs. That's true. The overuse of these anti-inflammatory drugs actually causes osteoarthritis down the line. Now, the conventional treatment of arthritis is primarily symptomatic. You have drugs to relieve the symptoms, and then you have surgery to replace the joints. Now, the NSAIDs are what we call non-steroidal anti-inflammatory drugs. These are basically drugs that relieve inflammation that are not steroid. These non-steroidal anti-inflammatory drugs are ibuprofen and naproxen and that class, Aleve. Now, these drugs increase the risk of GI bleeding, liver and kidney damage, and they actually accelerate cartilage destruction, the cushions within inside the joints, over time, which this brings on this bone-on-bone arthritis, which we call osteoarthritis. These drugs are responsible for about 16,500 deaths per year. That's deaths from GI complications. Now, the non-steroidal anti-inflammatory drugs, cartilage and bone. These drugs may contribute to cartilage destruction by inhibiting the production of proteoglycans. That's a combination of protein and carbohydrate. These are the building blocks of cartilage. These drugs are also associated with acceleration of bone destruction. Now, exercise. Moderate exercise prevents and improves arthritis. When you're moving your joints around, you're helping to lubricate your joints, you're strengthening supportive musculature, helps to maintain our ideal weight. So walking, swimming, any kind of exercise that gets the joints moving helps to prevent arthritis. Now remember, aggressive exercse, soccer, basketball, a lot of tennis, is going to put some wear and tear on the joints. But as you get older, you need to